ER workers, what is the weirdest or craziest case you have had walk into your emergency room? Had a patient last month come in because the glue on their toe stopped working. They didn't come in 2 days ago when their diabetic toe fell off, but came in when the glue stopped holding it on. I pretty much go to work always thinking people can't get any dumber. I'm proven wrong weekly. Story 2. Had a guy come in that got struck by lightning. We stripped him down, looking for the exit mark from the burst of energy. We couldn't find one, and were worried his insides organs were cooking from heating up from the energy of the lightning strike and at risk of failing. About an hour later, his friend showed up to check on the guy and let him know his dog was okay, and he got the dog home. He then proceeds to say, "Did you see the dog's collar explode off its neck? That was crazy." Turns out, the guy was holding the dog's leash when he got struck, and the energy from the strike traveled down the leash and exited through the dog's collar. I think about this often, and this happened almost 15 years ago. There's so many wild and unpredictable cases that come in, but this one has always stood out to me. Story 3. Not the most crazy, but we had a woman come in for a headache and her husband decided to get his nagging back pain looked at while we're here. He had an aortic dissection. Story 4. Was waiting to pick up a friend after a surgery and a lady pulled up covered in blood. She goes running inside. A second lady pulls up also covered in blood and goes inside. A couple minutes later, a third lady covered in blood walks up, sees the 2 cars sitting there, tosses her machete into the bushes and walks inside. At that point, I went and talked to security and they got the machete and separated the 3 ladies. Turns out, the first lady had been sleeping with the third lady's son. The second lady was married to the first one and she was the third lady's sister. And they'd all gotten into a knife fight because the son had posted pictures of him with her to Snapchat accidentally. Story 5. Had a guy, maybe around 2022, come in and had the wire of a pair old-school wired Apple earphones stuck up his Johnson, all the way to where the single wire split off into the 2 wires, so maybe 1 to 2 feet of wire up there. Claimed he passed out at a friend's party, and his friends did it to him. Had to x-ray to see what all was going on. The wire made it all the way to his bladder. What happens when you had those headphones in your pocket? Yeah, something happened in his bladder. So it couldn't just be pulled out, had to have it surgically removed. Also had a woman somehow make it past check-in, past triage, to the emergency bay. And when a doctor asked what was going on, she said that she sneezed and popped her stitches. I still don't know how she made all the way back there. Story 6. I spent 18 hours in the emergency room next to a woman handcuffed to the bed and 2 officers trying to explain she cannot leave. From what I gathered, she partied it up at an Applebee's, drove home, wrecked her car, broke both of her legs, and well was above the legal limit. She didn't understand where she was or why she couldn't go home. The police explained repeatedly that she was in a bad accident, the car was totaled, she was under arrest, and they wanted to know who her passenger was in the car for the passenger's safety. They could tell there was a passenger because the blood splatter patterns indicated someone else was in the car and badly injured. Hours later, the pain relievers wore off and she started to feel the broken legs. So, in addition to being completely unaware of where she was screaming in pain. That's what it's like on an average night in a level 1 air trauma center. Story 7. Walked in to help my colleague with a level 1 trauma. The lady had been hit by a machete and she passed. She was still alive when she came in, but succumbed shortly afterwards. Colleague was white as a sheet and swaying. I swiftly departed before I made a biological mess on the floor and had a bit of a cry. The ex had been waiting for several days for her to come out. Story 8. Had a guy set himself on fire at the bus stop in front of the hospital. Hospital staff on the way to work literally carried him in the ambulance bay. He was a crispy critter. Worst thing I've seen. Just charred everywhere. Story 9. Girl came in with a busted up face. We thought she was beat or involved in a serious car accident. Nope, she was tending to the family cattle and got headbutt by a freaking cow. It isn't the craziest thing we've seen, but it was pretty random and gave us all a good chuckle. We were laughing with her. She was making some hilarious jokes about it. Story 10. Air doc. The worst cases I see are the patients who only come to the ED for their care due to a lack of insurance and other social supports. Appropriate preventive care would limit many of the severe presentations we see. People can't afford their medications, healthy food, and don't have transportation to get to primary care appointment. They don't have sick time from minimum wage jobs, so they put off being seen for something treatable and then come into the ED at 2 a.m. because it's the only time they can actually get health care. That diabetic foot infection could have been treated in clinic. Now it's so bad it needs amputation. The CHFs are hypertension. Diabetes could have been managed well with mediation and diet changes at home. But patients can't afford their meds, so they don't take or stretch out the doses and then end up in the ED with an acute exacerbation. This is the worst part of emergency medicine, seeing how our society fails basic healthcare for so many people. Story 11. I was booking in one of my patients at reception in the early 00s. I could smell smoke and burnt meat for a few minutes before a man walked in, looking like an extra from The Walking Dead. He mumbled to the receptionist that he needed to see a doctor. It took me a second or so to get up and grab stretcher for him and take him into Reese's. The doctor in Reese's was royally pissed with me for not pre-alerting the dept. The patient had been burning rubbish in his garden and had managed to burn more of himself than the rubbish. Full thickness burns over all of his body and in no real pain whatsoever. Needless to say, he passed. Story 12. We had a patient who was hit in the rectum. Husband walked in on his wife and another man. He tried to run away naked and crawled under a table, and that's where he got hit. Story 13. Saddest. A woman gets brought in intoxicated after being assaulted. Earlier in the night, she got in a fight with her boyfriend at a bar, and he was arrested for assault. The police are nice enough to drive her home. The police find her 2 children being watched after by her intoxicated parents. Child Protective Services are called, and the kids were taken away. Afterwards, she wanders down the street and starts banging on doors at a motel. Police are called for the disturbance and find her naked in some guy's room where she may have been abused. She is passed out asleep for the last 6 hours of my shift. We ran basic tests while she was asleep. She wakes up and doesn't remember any of the events from the night before. I give her the story I was told by police and the ambulance crew that brought her in. She just stares at me blankly while I tell her and ask her if she knew I was pregnant. She did not. The police have taken her clothes as evidence for the assault. I pass on report to the next nurse taking over for her care. As I am walking out of the hospital after a long shift, I see her standing in the lobby yelling at someone on the phone to come pick her up. She is barefoot and naked except for her hospital gown. I question she decided to leave and the next shift just let her go, as we would have given her some sweatpants, sweatshirt, and socks before she left. I wondered if this was even close to the worst night of her life. Story 14. Not an ER nurse, but I had a chest pain scare just a few days ago. I was sat in a staging room with an IV in my hand, separated by a curtain from a man being triaged. The nurses asked him, "What are you here for?" And he goes, "Well, a while back, me and my girl were getting a little wild, and she put a toy up inside and it got stuck. It didn't come out, but then I got sent to jail for the last 7 years. It's been stuck there for 5 million years. I just got out. It didn't come out, and I'm sure it's corroded by now, and I just wanted to get it out, because if it corrodes, it might hit me. But let me make this clear. Y'all gotta know, I'm not gay. It took everything in me not to lose my mind at laughing." Story 15. Foreign objects, flashlights, and shot glass being common. Put where the sun don't shine, but apparently mag lights work. Every semester in school, at least weekly at the hospital I was working at, the waddle was always a giveaway. I have redacted prints of 5 or 6 goodies. Also, a guy whose wedding ring came off an inside of a woman he wasn't married to. Guys, if you're going to chest, take jewelry off. Story 16. I was with a family member. They're fine now. Down the hall, some poor lady was just screaming in pain. In the end, we asked the nurse what was wrong with her. She said, "Nothing, she's irregular and it's a small cut on her finger." People who work in the ER are a special breed to put up with all the craziness. Story 17. A pair of young boys came into the ER. Both were on the same two-wheeler. One was badly injured, and the other got lucky with just a SC on the knee. The moment they walked in, I knew they were trouble. Both were pretty drunk. So I thought maybe it's that. We were tending to the badly injured guy first, but his friend starts complaining no one was looking at him, but the nurse had already cleaned his wound and bandaged him up. Then after a few minutes, another whole gang of boys, we probably assumed their friends, walked in to meet their injured friends. Then they started creating a ruckus that no one is looking at the SCD knee fellow. We could all see all of them are drunk and called security, kicked them out. The guy got referred to a level 1 trauma center after stabilizing him. A couple of days later, police come in asking for them. Coincidentally, I was on morning shift that day. They came ask questions, but I didn't recollect anything particularly suspicious because they were asked for the whole week in the start. Then they told me the date, and then it clicked to me. I remembered those guys' face names and the date too, because all their friends were being as ass to me and my supporting staff. I positively identified them from the photo, gave their names and phone number too, because it's in hospital records. Turns out they were a gang of thieves partying after successfully robbing people of their bikes, phones, etc. The police told us it was an easy case because of confirmation. If they were nice, nobody would remember them because we get a lot of trauma cases. Story 18. Dude with gauged ears got his pet snake caught in his earlobe. Came in by ambulance. The snake wiggled out of the hole in the ambulance bay. Female doctor, who was very afraid of snakes, screamed and told the EMTs to put everyone back in the ambulance and go home. Story 19. Not me, but my friends are EMTs. They had a call where a man on substances lost his own arm to then pleasure with it, was still doing it with a smile when they arrived. Story 20. Hospital security, hospital peace officer for years. I mean, there's a million. I've told some of these stories on here before. Had a guy come in with a gash on his neck, claiming he accidentally cut himself. You could straight up see into his neck. Turned out his girlfriend hit him. Guy came in claiming some people tried to hit through the middle of his foot, like top down right in the middle. Had to hold him down while nurses gave him pain medics. Allegedly gang-related, but I never got a follow-up. Had a woman run up to our air security desk with her hands bound together claiming she had just escaped from someone's trunk. Had someone come in complaining of bad flu symptoms. Sat down while his wife went to park the car. Keeled over within 2 minutes of being there. Team ran out and started compressions until nurses came out, and some paramedics from the ambulance bay helped get him in the back. By the time his wife was back from parking the car, he passed. Overnighter is the only registration open, so pregnant woman in labor comes into ER to register. Her husband is talking to the registration staff, and she walks around the corner to the washroom. Registration and husband come around the corner to grab her, and she has her pants down and pushing while standing in front of the washroom. This husband half dives because the baby was literally coming right there, and he catches it like a damn football to prevent the kid from falling on the floor. It was like her 8th kid, apparently. I nearly delivered a baby one time. Husband came running into her saying his wife was in labor in their car. So I went running out with a wheelchair. She was refusing to get out. He went running off for nurses, redundant as I just radioed out to get some nurses out there. She pulls down her pants and says, "Baby is coming now." So I gloved up and was basically begging her to just get in the chair to get inside. She eventually said yes, and I dragged her out. Got met halfway in with a stretcher and nurses. She gave birth while getting wheeled up to delivery. One time at like 2 a.m., I see on cameras there's a small goat outside. I went outside and it ran up to me until the owner got out of his car. Goat's name was Rudy, and they were waiting for the dude's wife. Guess they had the goat on them when they needed to bring her in. That was pretty great. Story 21, perhaps not super crazy as others here, but saw a guy in his mid-20s recently who was brought in via EMS with police for medical clearance. This dude has visited our ED multiple times to get his chronic bilateral shin wounds dressed and leave our ED. He would not allow any staff to perform any workups and just yells to be discharged or goes "Amen." This time, the visit is different. Police found him on a sidewalk where they noticed swelling around his eyes and blood from his legs. They thought someone beat him up, which is why they called an ambulance. They didn't notice the blood was actually from his leg wounds in the ED. He was also pale too. A designated crisis responder was also at bedside for possible ITA hold. The doctor I was with was able to convince him for a lab workup and an IV placement. Labs were drawn and IV got placed. However, the patient started yelling to be discharged after 1 hour his workup was started, increasingly yelling at his nurse as well. DCR got psychiatry consulted, and they came into our ED. Psychiatry never comes to the ED, or we never consult with them for whatever reason. When the ED doctor, psychiatrist, and DCR were all talking, Lab called the ED doctor, and they told him, "Hey, your patient has a very low hemoglobin count. It's 2.6. Well, crap. That means DCR could not detain him to send him to a psychiatric facility, and our psychiatric unit could not take him because he was not stable enough. Let me remind that this guy wanted to leave immediately despite his emergent condition. DCR got a hold of their boss, and they told us that the ethics committee, psychiatrist, and ED doctor needed to get together. Doc and psychiatrist get on an online call with the ethics committee. They've all agreed that the patient does not have the capacity to make an informed decision. Some time goes by, 2 family relatives finally showed up. We updated them on the situation. The doctor, family, and I went in the room. Doc told him, "Hey man, you're like really ill and you need a blood transfusion because your hemoglobin is super low. We're gonna help you, dude." But this guy just kept refusing any further care. He has refused to verbalize the risks of leaving AMA. Also informed him of the medical intervention benefits, and without them, he could die. Family tried to convince him as well. He was then increasingly getting verbally aggressive and agitated with the doctor and family. He then repeatedly stated, "I'm done," for 10 minutes. Doc kept telling him, "I hear you, but we're gonna help you." He sat up on his bed and tried to get up, but the doctor stopped him. I had to step out of the room and gave a look at his nurse to get the medication, Zyprexa, ready. He ripped out his IV, cussed us all out. Security was called. Family shouted at him. Ducking crap show. I've documented a few amazes before, but never an AMA when a patient does not have capacity. We got a hold of his father, and he told us to do everything to stabilize the patient. Patient was admitted to internal medicine, and he left AMA like 2 days later. Story 22. Some guy got cactus thorns stuck in his throat because he was practicing. I was so happy to only be on registrar that night. Their nurse was not amused. Story 23. For about 6 months, my wife had been telling me I needed to go to ER. I couldn't walk from house to street without having to catch my breath. I kept saying, I'm okay, I just need to lose some weight. Finally, we were going somewhere with my daughter and granddaughter, and they saw me struggling. I couldn't defy all three of them, so they took me straight to ear. I was checking in, and my wife made sure they listened to her rather than me. Straight into triage, told not to move. A new nurse put me in a wheelchair and pushed me to a room. She and another nurse put me in bed. One had me stripped down in a gown, and the other was hooking me to a heart monitor. She started that, and doctor walks in a few minutes later. Before asking me anything, he looks at the paper rolling from machine. He asks if I had ever heard of a fib, if I knew it hit people. Then asked, why the hell hadn't I listened to my wife? 10 days in cardiac care unit trying to control it with meds. He comes in, tells me we need to get a little more aggressive as meds weren't doing what he needed. Says he is going to do a procedure called cardiac inversion. I'm going to give you a little shock to correct the rhythm. No big deal. After he left, my nurse asked if I had any questions. I said, no, he's going to give a little shock fix it. She tells me it's a bit more and give me all details. Doctor didn't. Give me a sedative like I'm going to have surgery. Then the fun part, stop my heart, then kickstart me. Twice. I was still joking as they wheeled me in wanting someone to film it for me. They refused. I was a huge bruise, nearly all around my torso. Felt like a few guys had me down kicking my ribs with steel toe boots. 4 days later, I left hospital. Within a year, I lost 110 kilograms. I just passed 5-year mark. I'm still 80 pounds down from then, not taking any meds. And I try to listen to wife more. Story 24. Had a 60s-old male PT come to ER due to severe urine retention. He denied any HX of prostate issues, chronic Foley use, wasn't diabetic, renal panel was within normal parameters. After 500 ml full drip IV fluids didn't produce any output, our ER flummoxed doc orders 2-way Foley cath placement. PT agrees to have Foley inserted, trying to insist a female nurse do it, because they know how to handle it better. No prob. One of the veteran, early 50s aged, female RNs comes to assist. And despite some slight disappointment on PT's face and slight insertion resistance, we get the catheter in and watch as the bag fills with about 900 ml urine. By the time we finish strapping the cath to his leg, etc. Pete expresses relief, but says he feels something sharp inside and winces every time he moves. We assure him that it's a normal sensation due to having a hose shoved up inside, but that we'll be closely monitoring his progress. Not even 30 minutes later, we hear a woman screaming and calling for help near this guy's cubicle. Turns out he had ripped the catheter out and was bleeding profusely all over the place. Ducking hell, but not that weird, right? Well, turns out this ducker had begun furiously do stuff and pulling the catheter. But when he gave his last pull, the catheter split, leaving the balloon lodged in his now hemorrhaging, saluting junk. Doc shoves some sterile gauze in him and off we go for an emergency CT scan. Lo and ducking behold, this man had another Foley cath balloon and a string of braided ribbons, almost reaching his prostate. A lot more happened after that, but long story short, he was immediately consulted with urology and psych and rushed to OR. Look, I don't kink shame judge or give a crap what you are into unless it's harming others. But please, people, at the very least, educate yourselves on the potential consequences of your fantasies before they're put into action. Some holes aren't meant to be clogged with ribbons, bobby pins, pipe cleaners, Foley cath balloons, etc. And don't ducking lie if once you land in the damn... We know damn well the embarrassment you're working through at that point. We don't give a single flying tinker's damn in that moment about why you feel ashamed. Just tell us the bizarre crap you have jammed up your orifices so we can expedite in an efficient manner. You are not the only weird, inexplicable person out there. You're just as unique as everyone else. Story 25. They all run together at this point. Recently had a guy come in, awake, that was riding a motorcycle and had a pipe fall off a truck and hit his face. Had another patient that was driving and a trailer hitch came through the windshield and hit the skull. Final destination stuff always gets me. Story 26. I was working night shift and a patient came in full lower leg splints, unable to walk. I received him in our fast track area, like an urgent care wing of the ER. Like he was covered from waist to ankles in cohesive bandage and splinting material underneath. I found out the day before they had left AMA from the ortho unit. Turns out I was working the night they came in 3 weeks prior. Person had jumped off of a freeway overpass onto train tracks, basically fracturing every long bone in the lower extremities. Upon doing a chart review during his new arrival, there were notes every day of him being a banana to inpatient staff, and he decided he wanted to leave AMA. Our discharge planners had pulled through and set him up for placement to get physical rehab, but nope, he wanted to go stay with a buddy. That plan fell through, so brought himself to the ER the next day. I came back the next night and asked my coworker how he had been. Coworker told me our discharge planners worked their magic and got him reaccepted to the rehab facility, but he chose to leave AMA again. Story 27. I had a patient who was an elderly woman who fell and broke her hip getting out of the shower. She lived with and cared for her husband, who had severe dementia. Due to her broken hip, she was unable to stand up or reach the phone to call for help. We don't really know how long she laid there. Her husband was eventually found wandering around in traffic, severely dehydrated and wearing soiled clothing. He was brought to the ER by police, but due to his condition and dementia, he wasn't able to alert anyone about his wife. He didn't have any ID and was so incoherent that he couldn't tell us his name. I ended my shift and went home knowing nothing of his story. During day shift, he became lucid enough to give his name and date of birth. Social work was able to reach one of his daughters, and a welfare check was called for his wife. I was just starting my next shift when they brought her in, and I was assigned as her nurse. The condition this poor woman was in broke my heart and was unlike anything I had ever seen. Somehow, she was still alive, but basically her body had already started decomposing. The bath mat and towel were basically melded to her flesh. She passed away about 30 minutes after arriving. Luckily, her daughter understood the severity of her situation and knew her mom's wishes, so we were able to make her comfortable instead of torturing her in a futile effort to save her. She was obviously not conscious, so I don't know how much she could understand, but she died minutes after her other daughter arrived, and they were able to tell her their dad was safe and they would care for him. I wonder if she kept herself alive against all odds, wanting to know he was okay. I think about her lying there, helpless, in terrible pain and literally rotting away way too much. I try to use the terrible things I've seen as a reminder to enjoy the good moments, but also, thank God I have an excellent therapist. Story 28. There was a shootout in the parking lot outside of our ER. One of the victims came running in screaming, "Am I gonna make it?" with a .22 sticking out. Apparently it went through glass and slowed the bullet down enough. I told him, "Well, you're walking and talking, so that's a start." The shootout was gang-related, and when one of them got shot, they all got in their cars and proceeded to shoot at each other all the way to the ER. Multiple victims, but he walked in. Story 29. Guy came in, we're flat out, was crazy busy, complains of a headache he has. Thinking to myself, oh, take 2 Panadol and go home. Anyway, he got sent round to CT scan. Even I can see the golf ball tumor in his. Learned a lesson that day. Story 30. Had a guy put a spork inside. He broke the end off and shoved hard enough we couldn't take it out at the bedside, and he had to go to the OR. He was a prisoner. He said, whenever they changed my meds, this happened. Needless to say, this was not his first rodeo. Story 31. A patient came in because while cooking, she thought she sprained her finger, so she had some decent pinky pain. No big deal. Meanwhile, a new tech was training, and they just got taught how to do 12 lead EKGs, which detect heart rhythm issues and whatnot. Typically, these get done on people with chest pain or rhythm issues. But new and not knowing better, they thought every patient was supposed to get one. They wind up doing one on this lady with pinky pain, and lo and behold, she's actually having a massive heart attack. She got rushed back to the procedure room, where it was found one of the 3 major arteries feeding the heart was 100% blocked, and got it open. Shortly thereafter, she said, "Oh, my finger feels so much better now." Moral of the story here: to save a life. Signs of a heart attack are typically sudden, crushing chest pain that people describe as an elephant sitting on their chest with radiation to the left arm and jaw. For men, that's typically the norm. For women, they can have a range of symptoms from those typical symptoms to shortness of breath and heartburn. Diabetics may have almost no symptoms at all. And occasionally there are total outliers like this patient who have insanely odd symptoms. If that tech didn't mess up, the heart attack may not have been found until it was too late. Someone with any kind of history of heart disease or with a strong family history of heart disease should be wary of any of these signs and get checked out. Story 32. I had appendicitis, and while still in the ER, they finally had me on the good meds. So to this day, I have no certainty if this was real, a fever dream, or a medics-induced hallucination. But the next curtain over, not seeing anything, just hearing, circa 3 a.m., a seemingly older couple was arguing about whether the man had something in his ear. The nurse or doctor was skeptical and looked inside and said they didn't see anything. The wife teased her husband, saying, "I told you so." The husband begged the staff to look again. So they did, and apparently a wasp flew out. Wife screaming, husband screaming, seemingly staff screaming at this loose wasp in the air. I hope the curtain kept it out of my room since I'm allergic. I fell asleep mid-chaos. LaMayo, story 33. Husband and wife run into the ER together. Man is holding something small, covered in a bloody-looking blanket, in his arms. The wife is hysterical, while the husband looks blank and confused. She screams that they need help with their son. She starts explaining that there was a 4-wheeler accident and their son was thrown off of it. Nurses grab a gurney and have the father lay the blanket on it, and they take it off. Just as they pull the blanket away, the wife pulls something out from under her arm that hadn't been noticed before, also wrapped in a blanket that's bloody. She plops it on the gurney, and it's the part of a body. She screams that he is still alive and demands that the doctors and nurses fix him. I do not work in a hospital, but was a witness to this event. The woman couldn't understand that there was nothing they could do for her son. It was so shocking and sad. The man was literally in shock, of course, and just didn't have any real reaction to what was happening. Story 34. Had a PT via EMT transport. Drank a lot of tequila and fell asleep in the shower. Hot water ran out about 5 minutes in, and PT stayed under the spray of cold water for hours. His skin just sloughed off. Not good. Pain meds couldn't make a dent because he needed so much his respiratory system would collapse. Transferred to level 1 burn unit, word was he died hours later. Story 35. Not an ER worker, but my sister was. The cops brought a guy in that they couldn't take to jail until the doctor pulled something from inside. Doctor would ask, "Do you have something there?" Guy always said no. Turns out to be a rubber duck with substances and a razor blade. I think the doctor, the cop, and the patient were all questioning the life choices that brought them to that moment. The Sarah from Colorado that bit the cop and pulled the ER fire alarm was a crazy. Story 36. I worked the front desk at an ER. A man came in with a gunshot to the balls. He had accidentally hit himself when putting his gun in his pocket at his company Christmas party. Didn't tell anyone, including his wife, until he absolutely had to. Turns out he was the security and safety guy at a major university where I live. Story 37. Always wear a helmet on an electric scooter, e-bike, bicycle, skateboard. If you think magically you are immune to falling and sustaining a head injury, you're an actual git. Toy got sucked up far enough, it had to be removed with OB forceps. MVC with person impaled by the gear shift. Fire cut it out off the car, and the handle was still lodged in the body. Took a PT's boot off, then his sock. Whoops. His dry, gangrenous toe flew off with the sock. CPR on a conscious person. The compressions oxygenated them awake. But once we stopped, they were back to being dead. Psych hold, climbed into the ceiling vent, and we could hear him running around all night. I had to confiscate a gentleman's prosthetic leg after he would not stop using the leg to hit people walking by. A woman interrupted a massive trauma code, walked into the room to complain her son was waiting for his discharge papers for 30 minutes. Story 38. I'm an endoscopy tech, but I get called in for emergency cases that come through the ED all the time. People accidentally and intentionally swallow all kinds of things that you wouldn't believe. Sometimes things get stuck in their esophagus and we are called to remove the item endoscopically. Most common offender is steak. Chew and swallow, folks. Wasn't an ER patient, but one day I was working. Another team saw a bee in someone's colon during a colonoscopy. We're all still scratching our heads about that one. Story 39. We had an elderly man that had fallen outside of his house and then accidentally locked himself out. He lived in a very rural area, miles from any neighbors. It started raining, so he got in his car and waited. It was summer and in the 90s. A family member came over 2 days later and called 911. When he got to the ER, he had bandaged his forehead with napkins. When the doctor removed the napkins, maggots were everywhere inside the wound, on the napkin and falling out. He ended up admitted for dehydration and stayed a couple of days, then released home. He was so sweet and soft-spoken. I hope he's still okay. Story 40. This story is 100% true. Work security for the ER. A homeless guy drove himself in with a toy shoved so far it got stuck and needed to be professionally removed. Said homeless guy had a dog in his car that he let out to roam the parking lots. Dog was dirty and aggressive and undisciplined, so it was running around the building chasing people. We get called to deal with it and we wheel him out to put his dog away in his truck. Eventually, he gets discharged and leaves, only to come back claiming he had left his phone and wallet. However, the room had already been cleaned and we don't allow people who aren't patients or visitors back on policy. Also, at this time, a huge wreck had just happened and multiple injured people were coming in by ambulance with their families in tow. So we basically tell the guy, we will keep an eye out for his stuff, but he needs to get lost right now. He throws a fit and proceeds to linger around outside. A sheriff's deputy that we all know drove up to come say hi to us. And this is what makes the guy decide to leave for good. The real twist to this story, though, he never had a wallet or phone go missing. It was an excuse to get his sex toy back. One of the nurses found it, and we threw it in the trash. Story 41. My relative who used to work in an ER has way too many stories of objects stuck up. Then there are the sus stories of a couple coming in because the girl backed into a knife. Story 42. One had a patient take an ambulance because her feet were swollen. She had sock edema. I showed her my sock edema as well and discharged her. 2. Motel remote up inside, stole the remote out of the biohazard bag once removed when he was discharged. 3. Sex toy also up inside. Could feel the vibrations through his belly. Story 43. We had a patient come into the ER after her son found her unconscious with an empty bottle of Medix that was prescribed 2 days before. She was unresponsive for days. When she woke up, I was on shift and sent to the ICU to talk to her about the OD. She told me she thought if she took 30 milliliters of benzos, she would sleep for a week and lose 10 pounds. Story 44. My friend was an EMT, said the worst he had was a guy who had been hit in the face. He was still alive, but when they tried to intubate him, he didn't make it. Story 45. I was only and rent a cop, but I saw something. The one that really stands out is a dude was rushed into the ER and brought into the trauma room for reasons I can't remember. The staff had called me because he was very agitated and was arguing with the nurses and doctor about literally everything. Try to administer meds, he'd start arguing and denying them. Try to draw blood, he puts up a fight. The doctor had finally had enough and said something along the lines of, "You have a history of pulmonary embolisms. You know what we're doing, and we have to do it quickly or you will die." He reluctantly agreed and let them all do their thing. I went on about my day, and maybe an hour later I get called to bring the morgue cart to the ER. I was confused because I hadn't heard any traumas or codes being called. Brought the cart up, and it was for the dude who'd just been arguing with the people trying to save his life. He basically hit himself by arguing with them. The reason it stayed with me, because barely an hour before, the dude was full of spunk, ready to throw hands with the lab tech for trying to draw his blood, and now he's pass. Story 46. Not in the ER, but on an ambulance. After dropping a patient off, we were asked by the nurses if we could help transfer a bariatric patient to a correct-sized bed before we left. So anyway, when we opened the door to that ER room, the smell that came out is something that I've never experienced again, but somehow years later, I can still randomly smell it. The lady was literally rotting. So yeah, not something I enjoy talking about, but that is a wild one for me. Story 47. Not ER, but surgical assist patient came in after lost his wiener. We surgically reattached it, and once the patient became lucid, he was furious. We put it back together. Story 48. I once triaged a male who injured his balls by straddling and humping a stone wall. I couldn't help myself and said, "Well, it seems like you found yourself between a rock and a hard place." At that time, laughter was not the best medicine. Story 49. Thanksgiving Day. We're at the ER because X broke his leg. In the bed next to us is a couple, and they're whispering things like, "I can't believe that happened, and this is wild." Doctor comes in and tells them after looking at images, sure enough, the man has a BB stuck behind his eye. Removing it could cause more damage given the location. Best case scenario, his body will just calcify it. Told him to go see a specialist. But for right now, he was fine, with no damage to his eye. Story 50. This was related to me by a woman who was a nurse at UCLA Hospital back in the mid-80s. Saturday morning, a woman comes into the emergency room with this huge gash in her forehead. She explained that she had been at a party and was sitting on her boyfriend's shoulders when he walked through a too-low door. Weird, but okay. Late the next morning, about the time when somebody would have stumbled out of bed after a wild night partying, a guy is brought into the emergency room by two of his friends. His back is in spasm, and he is unable to walk. You see, he had wrenched it when he was at a frat party the night before. His girlfriend had been sitting on his shoulders when he walked through a door that was too low. When she hit her forehead on the door, it gitted her backwards. Story 51. Before medical school, worked as an orderly in ER at local small-town hospital. Triage desk where nurse sat had a button that triggered an alarm light that called security and the orderly. The orderly always got there first since we were closer. One Friday evening in January, with about a foot of snow on ground, the light goes off. I go out to desk and there's a man in a buttoned trench coat, shoes and socks, and obviously wearing shorts or no pants. Reason nurse hit the button. Nurse asks what the problem is, and he blushes and stutters and says, "I was vacuuming and had an accident." Nurse asks, "What sort of accident?" Guy opens his trench coat, revealing he had no pants on, and a vacuum cleaner hose falls out with one end firmly stuck on his junk. Said he was a nudist and slipped while vacuuming his house. Sure, everyone believed that. In the end, those blunt scissors that cut through anything were required to free him after other attempts failed. Story 52. My dad told me a story that while he was in residency in Brooklyn Hospital Air, a woman came in with one breast almost completely off her body. The whole time he's stitching her up, she's saying, "I'm going to get the Karen that did this to me. She's going to pay." Once stitched up, she checks herself out. Not an hour later, another woman comes in with her breast almost completely lost. Our dinner table conversations were wild. Story 53. Guy hit his rectum, so he called EMS. Apparently came through the air, lying on his belly with several inches of the knife sticking out. He had to have surgery to repair his colon and had to have a colostomy bag placed while he healed. He wasn't actually my patient. I just had to read his chart because he called to complain that the nurses didn't give him his BP medication on time, and the food was terrible. Story 54. I have a regular from prison who is in the habit of sticking things up inside himself for pleasure. Being in prison, this makes appropriate items limited and requires him to be a bit creative. So far, I've seen him with all the teeth of a comb, all cutlery, 2 rubber pens, 1 regular pencil when he pulled from the ceiling or wall, paper syringe stolen from the hospital, story 55, not error, but did a surgery on a guy who hit himself. Went under the chin, but he hesitated and moved at the last minute and hit most of his face. He then drove himself to the hospital. Story 56. I was non-clinical admin staff at the local ID for many years. Patient was escorted into the ED by Leos for paranoid delusions and dysregulation. He was sober with a remote history of substances use and mental health issues. Friendly and polite, but clearly disturbed, claimed he was being followed by drones and his communications were being monitored by the government. I had previously worked at a law firm that did insurance fraud investigations, and between the lines of his dysregulation, some of the dots started to sound familiar to me. Turns out he was right. He was being followed, and his comms were being monitored. Once I figured it out, it took about 2 minutes for security to clock the investigator in the waiting room and politely tell him to get lost. To be fair, he had all the mechanics and details wrong, but he was absolutely right to be paranoid. Story 57. Labor and delivery triage. A woman who didn't speak English recently had a cesarean section. She came in when her stitches dehisced, separated. She was sewn back up and given antibiotics. A short while later, the stitches dehisced again, and she presented with pus. Her wound was restitched and she was discharged on antibiotics. The last time she came in, the pus in her wound was cultured. It wasn't pus, it was semen. Deep education was required for her and her partner, story 58. Local PD brought in a drunk driver after an accident. The patient was still blitzed and was handcuffed to a stretcher since he was under arrest. Patient had to use the restroom, and the officer took him down the hallway and stood outside the door while he did his business. Several minutes passed, and drunk patient does not open the door. Hospital security comes over and unlocks the door to find an empty restroom and ceiling tiles out of place, overheard. Local FD is called in to use their infrared equipment to look for the guy in the ceiling. He was eventually captured when his legs popped through another ceiling tile, and a nearby nurse ran over and wrapped their arms around drunk guy's legs and pulls him through the ceiling. And that is why all patients under arrest are handcuffed to the safety bar while in the restroom. Story 59. Bikers coming in to threaten the surgeon who placed an ileostomy bag on a biker. Biker didn't take care of it, and he became septic. But no, it's the DRS fault. Story 60. My boyfriend lost a finger. I dropped him off at the hospital but had to go back to the finger at the ER. No one believed him that he had lost a finger because he was so calm. They made him wait to be triaged. He was waiting in the ER. When I rushed in with the finger, sobbing, I have it. And then the nurse was like, oh, and we got sent to the backstory Mount Hun. Guy lost his hand during 4th of July. He comes in white as a ghost with a towel wrapped around his hand stump. Mom was extremely pissed off that he was screwing around and proceeded to pull out a Ziploc. She haphazardly hands them over and says to her son, you'll be lucky if they can put any of these back on you. Story 62. Only a med student, but just got off my ER rotation. Tragically, I didn't meet the patient myself. This was just before I got on shift. Warning for being real gross about eyes. Guy gets hit in the face with a board that has a bunch of staples in it. Staple gets in his eye. Comes to the ER on day 4 of having a staple in his eye. When ophthalmologist comes and gets the eye open, the pressure causes the eye to explode off his lens. I saw the picture. I thought a tooth had lodged itself in his eye from a car accident or something. The residents had to tell me what it was. I later learned that his substances screen came back positive for substances, which explains a lot. Story 63. Guy wandered in around 3 a.m. in his 60s, gruff logger looking type. I was the person who took their ID and registered them so they could speak to a nurse. At the time, I'm the only one at the desk. He starts rambling about never feeling quite right about their stuff and how he had lost part of it off tonight but was not successful. Calm and chipper about the whole thing. Heard there was a whole mess down there when they checked him out. Story 64. Woman said they shoved something up inside years ago and never thought anything of it until she started to have foul discharge and pain. CT scan showed razor blade looking items inside her. Transferred out to a higher hospital and they found multiple razor blades. Story 65. Ha, not me. But my dad's friend was an ER physician. He had all kinds of stories, but the funniest one was a guy that got his junk pierced and then wanted it removed but kept calling back in asking if the second hole would close because he couldn't control where his piss went. Story 66. I don't work in an ER, but my observation is that with people video recording themselves doing stupid things, it must make the job of the medical staff easier when figuring out how to treat the patient. Story 67. The woman that took an ambulance at 11 p.m. because she got bit by a fish. The man that loudly exclaimed that he wanted tested for AIDS in a packed waiting room. He had no symptoms, simply explained, "I did someone, and I'm pretty sure they had it." The man that came in for a stomach ache stated, "My friend gave me some cheese that I think was moldy, but I couldn't tell because I ate it in my room with the lights off." Many odd cases. I miss it. Story 68. Had a homeless man who looked like a dirty Santa Claus in go-go shorts come in for a toothache, but claimed he was pregnant and wanted me to treat him as he was pregnant. He said he and his duck buddy has been ducking 1 times without protection and may have caused him to become pregnant, but now his tooth hurts. I was the on-call emergency dentist. I was not prepared for that. Story 69. Had a patient with a significant hangman's fracture walk in after an injury that had occurred 24 hours-ish earlier. Came in because he couldn't sleep and slept sitting up. Drove himself to the ER the next morning. Imaging was done, and neurosurgery was like, nope. No one could believe the dude had just walked in. Flew him to the larger level 1 trauma center that was 3 hours away. Story 70. Not an ER worker, but I was waiting to check in at the ER a few years back and overheard a really unfortunate story. It was a girl with her boyfriend. Apparently, they were wanting to the deed for the first time and thought they needed to pop her cherry first. I don't exactly remember how, but somehow they shoved a sewing needle up there, and surprise, it got stuck. She was acting completely normal though, so I'm hoping she walked out of there with no damage and a better education on how sex works. Story 71. I remember being 11, my mom worked intake and stuff in ears my entire childhood. One day she comes home with a look of despair. So I asked what happened. She had a lady come in with a bowling pin fully inserted inside her and couldn't get it out now. Hearing this just blew my mind, and I think she only did 2 more years before exferring to insurance stuff. Story 72. My own story. Parents were at work. My granny was visiting us in South Africa from the UK, and she went shopping. So I was left with our maid. This was late 80s. From what my dad told me, I found one of those disposable plastic picnic knives and got intrigued and put it in my eye. The doctor said because of my reaction, the knife went upwards into my eyelid rather than directly into my eye. Story 73. Just last week, we had a guy come in sporting from his femoral artery. He had just had a valve replacement that had been done through his leg, and he blew the sutures. There was blood everywhere. Ceiling, walls, people. Story 74. Among the horrors, a rancher's wife had her hand shut in a gate by a cow. Lost all 3 middle fingers and part of her palm. There was no way to reattach them since it took a few hours to drive to town. No cell service out that far. Story 75. Not an ER worker, but I brought my son to the ER because he'd clearly broken at the very least his toe, if not his whole foot. He refused to tell anyone how he hurt it. Nurse is like, "There is nothing I haven't heard or seen. Just want to help." Kid says, "Oh yeah, what's the craziest way someone has broken a bone?" Nurse says, "Recently someone was beaten with a frozen fish." Story 76. Saw a woman whose head had been beaten. Next door neighbor was cheating with the lady's husband and sent her son over to lost the woman. It was horrible. Story 77. Wound to the right ventricle and hand, but they missed all the important stuff in the hand and they kept him alive long enough to get to ore. Dude was up walking within 48 HRs. Absolutely unreal. Story 78. A friend who's a nurse had an older gentleman come in with pain. When they went to do the exam, they found that he had a plastic baggie rubber banded to his junk to stop it from leaking urine. The junk was green and gangrenous. Emergency responders of Reddit. What are some dumb things that have led to an emergency situation? Story 1. Paramedic here. We responded to this 54-year-old having chest pain. Man was having a heart attack. Dude didn't want to go to the hospital because it's too early in the day. That's it. We tried to convince him to go. Got the ER doc to talk to him and he wouldn't budge. He signed a refusal. Later that same night, his family found him, dead in the living room. We got to him and started CPR, meds, everything. Dude didn't make it. When we advise you to go to the hospital, go. Story 2. Got called to a priority job. The caller was kayaking in a lake and said that there was an unresponsive male in the water. So off we went, lights and sirens. We requested paramedics and fire to attend as well for the rescue operation. There were about 6 emergency vehicles attending, including a rescue boat. We got there within minutes and met the caller who showed us where the guy was. He was just swimming, minding his own business. The caller said he was unresponsive, but really he was just ignoring her. Had a chat with the guy. He seemed all right, said he swims here every day and likes the quiet. No issues. Would have been nice if the caller told the operator that he was still conscious and swimming rather than unresponsive. Story 3. I had a client once who was basically Ricky from Trailer Park Boys. Loud, obnoxious, hilarious, and every second word was some maritime slang or a derivative of duck. He has been on daily eye drops for decades for dry eyes. Sure, okay, cool. I hear screaming down the hall and run in, and he's wedged against the wall and the bed just screaming, "I ducked up, boys. I don't know what the duck is ducking happening, but it's ducked." Turns out he mistakenly put Jublia, which is an antifungal ointment for toenails, in his eye, thinking it was his eye drops. The strangest part was the bottle has this miniature sponge at the end, so you soak the sponge, then paint it on like a gel. He painted this antifungal ointment onto his eye, which immediately went red and angry, then proceeded to do the other one. So he's at the eye wash station, and I'm talking to Poison Control, and they are pretty stunned because they have zero data on what happens to a human eyeball when it's painted in antifungal. I can hear the staff at the other end kind of snickering under her breath, and she asks, "Can you compare and contrast the eyes?" Well, he put it in both eyes. The line goes silent because I can tell she is howling. Guy was totally fine, but it was a standout for sure. Story 4. An interesting bloke lit a fire in a 40-gallon steel drum so his goats could keep warm in winter. The drum was inside of a barn full of hay, no flue. One of the goats knocked it down, presumably, and set the whole place alight. 12 appliances were required to bring it under control. Story 5. Got called to a shooting. A guy says he received a text message from an anonymous number saying his brother has hit. He checks all the hospitals with no luck. He goes to his brother's apartment, but gets no response at his door, but sees his car and can hear the TV on. We get there, attempt to get an answer at the door. Eventually, we kick the door in to make sure he wasn't dying in his apartment. We boot the door, announce police, and find him asleep in his bed. The guy tells us that he got a new phone number and decided to mess with his brother by texting him he had been shot. He then fell asleep and forgot about the text, and was woken up by us. So many wasted resources on his idiotic prank. Story 6. Responded to a call of 2 children being kidnapped and their parents being beaten in front of them and then taken someplace else. They were held captive in an apartment out of hundreds of residential apartments, which not easy to locate. Upon reaching there, we found out that the boy was just playing with us to see if we would actually respond. Their parents were so embarrassed by all of that and vowed to not give them mobile until they are adults. Story 7. Woman ran out of gas, filled up a 2-liter Fanta bottle at the gas station and walked back to her car. Tried to dump it in the tank but kept spilling. Decided to illuminate the situation with her cigarette lighter. Luckily, she was not seriously injured. Guy got into an argument with his child's mother. He tried to hold onto the car when she drove away and was substances about 2 blocks. His feet were all messed up, so he decided to clean them off with a jug of Arbor Mist. These 2 incidents happened within 3 blocks of each other. Story 8. Kid driving his new truck down a residential street, wet from a recent rain, lost control and hit a parked car, overcorrected and rolled it once back onto its wheels, up onto a lawn. He told the fire chief he had gunned it to impress his girlfriend, and the chief just looked at him and asked, "So, was she impressed?" Story 9. One of my old bosses once built a new shed in his backyard to replace his old, worn-out one. He moved everything from the old one to the new one, then decided that the best way to remove the old one was by burning it down. He ended up with no shed, and the nickname Sparky. Story 10. Not going to the doctor for 20 years and then finding out you have a laundry list of health problems after your second heart attack because you thought the first one was bad gas. Story 11. Paged to a fire at a campground in the early morning. Fire department is hosing down a big class of motorhome. The occupants are my patients. Story goes as follows. They were of retirement age and had just bought the motorhome a week prior. They were on their first trip. They had awoken to the gas alarm going off and smelled gas. The husband proceeded to search for the source of the leak. Naturally, he's looking through cabinets and opening compartments. Unbelievably, he decided to use his cigarette lighter to help him see. Yep, smelled gas and lit his lighter. Obviously, the whole thing goes boom right in his face. They managed to escape the camper, which burned to a total loss. I gave them an assessment, and they actually had only minor injuries, mostly to pride, I think. But I still remember his beard. It was so brittle after having been cooked a bit. It was breaking off in little bits that I had to sweep out of the ambulance later. Good times. Don't use your lighter to find a gas leak, kids. Story 12. Double-leg amputee drove his lawnmower a mile down into the woods, had the battery die, and got stuck. It was toned as double-leg amputee on a mower, so everyone thought we had catastrophic trauma. Policy also dictated a helicopter being dispatched. We all get to the scene to find out he just can't get back to civilization. They carted him out on a UTV. "It's me! I'm the idiot!" he proclaims before getting into his adapted pickup, nearly backing into our truck and driving off into the night. Story 13. Had 2 kids being kids, arguing over something inane as kids do, while walking on a bridge over a waterfall. Big brother shoves little brother loses footing, slips through the railing, goes down the waterfall. Didn't find his body for 3 days, story 14, leaving a door unlocked that opens onto an unfinished deck with a 10-foot drop to a concrete slab while having a party. A guest decides to take a piss off the deck and winds up with a broken back. Story 15. Not an emergency responder, but I worked customer service for years, and we had emergency responders come to help us with this case, so I'll tell the story for them. Years ago, behind the counter at McDonald's, they used to have these glass see-through kettles for the tea. We had an enraged, drunken customer storm behind the counter, grabbing things and throwing them all over the place. He grabbed the boiling hot kettle and smashed it against his head, panicked as he realized, slipped over in the mess he'd made on the floor, and ended up sitting down on top of the largely intact glass bottom of the kettle, and it cupped nicely around his bottom, impaling several times into his, well, you get the idea. Needless to say, first aid hadn't prepared any of us for this type of thing, and we basically just stared at him with our eyes and mouths wide open until the ambulance got there. Story 16. I had a 28-year-old patient come into the ER in status epilepticus. Basically, a seizure longer than 5 minutes or more than one within 5 minutes. This poor girl had been status for upwards of 40 minutes. This patient had a plethora of medical issues for which she took several medications. Her mother, who was not a doctor, decided that she was on too much medication and just decided to stop giving her several of her daily ones, seemingly at random, from the way she told us. One of those happened to be her seizure medication. From the time she started seizing to the time EMS brought her in, and we sedated her, it was an estimated 40 minutes of seizure activity. She ended up intubated, tube in her windpipe, and heavily sedated, and when my shift ended, she was still there waiting for an ICU bed. All of this because someone thought they knew better than a doctor. As for why the ambulance crew didn't sedate her, I can't speak to that. I wasn't there. Story 17. I'm not an emergency responder, but was the cause of a dumb situation and also the response to the situation. I was on staff at a BSA, Boy Scouts of America camp back in 2004. Everything is pretty much like it seems in the pictures, really. High energy from staff members, people with a willingness to share experience, games and learning scenarios, and of course swimming. Outside of regulatory training and procedures for keeping the youth safe, there are also drills and practice for certain situations. Tornado drills, fire drills, and lost camper drills, to name a few. While swimming at this particular camp, you have to have what's called a buddy tag, placed on one of two boards, in water and out of water. There is no solo swimming allowed. If yours or your buddy's tags were not together on the same board, then a lost camper drill ensues. Now, strictly speaking, staff didn't always follow the no solo swimming rule, and I was no exception. Everyone else had gone to bed, and I decided swimming in the moonlight was the perfect end to an awesome day. As a habit, I moved my tag to the in-water side of the board, swam for about an hour, then decided to fall asleep under the stars near my crafting center instead in my tent on staff row. When morning rolled around, all I heard first was the alarms going off from the speakers, tons of people running, and I was on it too. A camper was missing. We all rushed down to the water and locked arms, dragging our feet in a wide area in case they were still underwater. There were people checking the woods, the parking lot, the campsites, and the latrines. We looked for hours for the camper before they called us from the water back to the beach to declare it to the police that a staff member, not a camper, was missing. A staff member? How irresponsible of them. I looked back and forth between my teammates, but I didn't notice anyone missing. Sir, who exactly is missing? All eyes on me. Like a student asking a teacher about yesterday's homework. Where have you been? Me? Yes, you? Looking for the lost camper. You're the lost camper. No, I'm certain I'm right here. It took 20 minutes for us to get everything sorted out. Thankfully, everyone was understanding and we chalked it up to a long training exercise, but I, understandably, was never invited back to be on staff. Story 18. While in high school, an ex-student came to visit and we asked him what he does for a living. He said he's an ER neurosurgeon. We asked him for stories, of course, and he said he was brought a man who was hit on the forehead and still alive somehow. He told us he had to call his older colleagues who were off shift to come to assist, because based on what he learned in med school, the dude should be dead. His older colleague told him jokingly that if the patient dies, it's not on the ex-student because nobody has ever seen something like this. The patient made full recovery. The patient said he'll change his ways and stop doing dumb stuff, only to be brought in a few weeks later due to a motorcycle accident where he fell and hit the sidewalk with his head. He had no helmet. The air surgeon said he could only watch him slowly die from the concussion and bleeding that followed. He said it was shocking and traumatizing, but he eventually made peace with it. He said that he could save people from many injuries, but in the end, he can't save them from themselves. Story 19. Not quite an emergency, but you'd be surprised at the number of people who leave their cars running with the keys inside and are shocked when someone jumps in their car and drives off. Forgot to mention the people who leave their belongings in the front seat with the windows rolled down and then are shocked Pikachu when they come back and their stuff is gone. Story 20. Back when I was lifeguarding, I had a family bring a big circular pool raft to the beach. As soon as I saw it, I ran over and told them in no uncertain terms that it was unfit for the ocean, and especially the conditions we had that day, 3 to 4 foot waves with stiff offshore winds. The mom barely even acknowledged me, just said they know what they're doing and will take it outside my zone, so I'm not allowed to whistle at them, which is not how that works. But I figured it was easier to watch them closely than deal with calling the cops. I regretted that decision once I had to paddle a few hundred feet out to manually tow a couple of screaming teenagers into shore on the raft. Arguably, something I could have called the Coast Guard in for. But the crap-eating grin I got to have while filling out the incident report with the mother made it well worth it. Long story short, don't take inflatables in the ocean, especially when the wind is offshore. You're sitting on a sail. Story 21. Depends on the kind of dumb you want. Mine aren't as interesting as some others, but here's a few. Toddler locked themselves in a bedroom and wouldn't open the door. And the mother was a bit wacky. One of those frequent calls kind of places always with weird calls. We had some old guy who was living in a tent in the woods, smoked far too much and thought he had a stroke a few days ago. Guy wasn't really homeless or anything, more of a religious thing, I guess. Either way, the guy was stoned out of his gourd. One kid, 17, 18, so I guess not a kid, who constantly likes to drive fast, has gotten more tickets and arrested more times than I can count. Crashed his Chrysler 300 with a Hemi, got it back after 3 months. 15 minutes later, he ended up hitting an older couple's SUV while doing around 115. Old couple was miraculously okay. Chrysler was totaled, and the kid got a fistful of tickets, and I believe his license was taken not long after. Would be another stupid kid making stupid decisions. Changes things when his father is our first assistant chief and has been a first responder for 20 years. Story 22. Not a first responder, but I saw someone do something stupid that led to the hospital. I used to sell appliances. We would have a lot of scrap units come back from customers' homes after they bought something new. Dryers sometimes would have change rattling around in the bottom. One of our guys once found a $50 in a dryer just by a stroke of luck. Upon hearing this story, one of our newer delivery guys decided to take apart a dryer to see if there was anything in it. He didn't know how to take it apart and started prying the top off with a flathead screwdriver. The screwdriver slipped and hit him in the eye. He got off pretty easy with just a scratched cornea and an eye patch. After he left for the hospital, I took the access panel off of the front and found 75 cents. He tried to file a workman's comp claim, but it was rejected because he wasn't performing one of his normal job functions and he was being an idiot. Story 23. Just a couple. Got a chest pain job. Guy's implanted defib was firing over and over. Broken, strange, non-life-threatening arrhythmia. I can't recall, but he was perfusing well and walking around. Gah! As loud as you can imagine. We heard him from the street. Gah! Hit me already, poor git. Still have the EKG somewhere. Amazing. Sir, do you know what might have brought this on? Duck me if I know gah. Goddamn Jets couldn't score a gah. Touchdown if I carried them to the gah. End zone. Ass gah. Holes. Got a job for a woman bitten by a horse. Arrived to find a mom and 5 kids in a paddock right next to the road. She was bleeding gorgeously from the hand, through a blood-soaked towel, with the kids screaming and crying. She thought that since horses were vegetarians, it wouldn't bite her. She didn't know how to feed a horse an apple. But they're vegetarians, she said like 5 times. I wanted to say, so are lawnmowers, but they'll take fingers too, you nitwit. Story 24. We recently had a homeless man set a large trash fire in a field, so someone would see it and we would respond and put it out and he could talk to us. His whole reason for wanting to talk to us was because he smelled something dead. He lived in a giant scrapyard full of concrete and rebar, where any animal could have crawled in and died. Story 25. Not an emergency responder by profession, but I used to be a radiation safety officer, RSO, for the local branch of a test lab I worked for. This story doesn't directly involve me, but I was responsible for any radiologic incident in my own office. This happened in a nearby branch. The radioactive materials weren't large quantities or fossils, and extremely well sealed in layers of metal capsules. These were then encased, one of each 2 types, in a machine about the size of a shoebox, with a 12-pound handle. But because of the NRC regulation tightening after 9/11 and other scares, they had to be strictly handled, used, and transported. FFW to event. A field tech in our Houston, tech's office, was on a job site with one of these instruments and received a call that his pregnant wife had been rushed to the hospital and it was something to do with the baby. He, in a perfectly understandable panic, jumps in his company truck and books it towards said hospital. But he had left the instrument on his open tailgate instead of properly locked and secured in its mandatory regulation case. It fell off on Interstate 10 in the middle of Houston, eastbound, and is immediately run over by the semi behind him. He does notice the commotion and stop, but the device is completely destroyed. Catastrophically enough that one radioisotope capsule had been broken free and was missing. Now this source has a maximum activity of 40 MCU at time of certification, and decay ensured it was even less now. And it was double encapsulated in stainless casing. It would take direct, drastic, destructive force to rupture it, like a cutting wheel, bandsaw, etc. But because it is a certified sealed source of reportable quantity, he had no choice but to inform his own RSO, immediately after condoning a 15-minute radius off around the destroyed instrument. So, regs dictate that the RSO head there immediately while identifying fire officials and state nuclear regulatory officials. The RSO arrives with a survey meter, Geiger counter, AMD, about the same time the first emergency responders arrive. Just local fire with SCBA, so they just helped shut down the scene. So this was about noon or 1 p.m. The second source was obviously missing, and now there's a real problem. So after the RSO does a sweep with their meter and doesn't locate it, they updated the state reps en route to the scene. They arrived with more sensitivity equipment and a portable containment enclosure. They sweep up to 1.5 miles back, past the first skid marks from the semi. No luck. The main interstate through Houston was shut down one way for 10 hours, during which multiple sweeps of every conceivable piece of the scene was surveyed. And it was a big, huge, ugly traffic and hazmat flustercluck. The source was never located. It was finally decided by the upper management in the state agency that the source was highly unlikely to naturally breach, even if run over even 10 or so more times. It wasn't active enough to be dangerous and was only an alpha emitter anyhow. In my state, that's up to a 50K for everything up to the point where the source was ejected from the base of the instrument. Not sure about Texas, but I do know everything past that point was somewhere. Here, an additional 100K in fines between the tech and the company. He immediately lost his job, cannot hold a radiation safety certificate or hazmat transportation cert ever again. The federal NRC also took notice, and basically every branch of the company was subject to extensive audits of their radioactive materials licenses within the next 6 months by state and sometimes federal reps. Yeah, he was scared. Yeah, he panicked. Yeah, he made a stupid but massive mistake. Story 26. I'm basically a lifeguard at an indoor pool with some additional duties. But I have stupid crap on the regular, really. We have a wave generator and a seawater pool, actual ocean water pumped, heated, and filtered. So that combination is what really causes a lot of problems. Had a woman in the shore area where the waves break, shallow part. She fell over, and the waves washed over her head over and over again. Couldn't get back up. One of us helped her back up. I shut off the waves, then restarted once she was in the safe area. Stupid woman goes back to the same spot she went under a minute ago, loses grip and goes under. Again, we shut off the waves again, help her and bring her to safety again. Another minute later, she is underwater again. And every time we rescued her, she was in danger, trust me. She just laughed, like she found it funny. We had to forbid her from being in the pool when we run the waves. This I saw 2 days ago, had a group of mothers with children in the pool. First wave start, I already have my eyes on a young girl, swimming in front of me but seemingly struggling. I look around. Sure enough, mom is giving 100% of her attention to her other child in the children's area, while the daughter is struggling in deeper water. Waves get stronger, she goes under. I grabbed her arm and pulled her out. Mom did not notice. Same group, I saw a woman kind of go under twice. First time, waves start and she is in the shore area and does the dumbest thing you can do. Hold her baby tight, sitting on the floor of the pool, slightly above the water level. Every normal person unfamiliar with the waves would stand there and let the waves start. What happened to her? Of course, she lost balance after the fourth wave and stayed under for a moment. Could not get back up though because she ducking refused to let her baby go. All went well though she got back up after a moment. But the second time, her baby toddler throws his toy in the pool. Deeper area. Wave. Mom goes after it, grabs it and tries to give it back to her child. Falls over and can't get back up. This time it's serious. I jump in, help her back up, but she still tries to give that god-ducking damn toy to her child. It all worked out. But if I didn't see that there, she could have suffered serious problems just because of a stupid floating toy. I want to add to the last story. Normally when we jump in, the second lifeguard, always 2 people, has to turn off the waves, emergency stop. This time we were 4 people, me, my shift colleague, who is far more experienced, an apprentice, and the colleague who is on his way out basically, and neither of them turned off the waves. I actually lost ground myself trying to help that big woman on her feet, and she nearly hit her head on the wall. And they still did not bother turning off the waves. Story 27. I was riding third seat as a trainee when we get a call for a guy having a seizure. When the address comes in, the two medics I'm shadowing look at each other and roll their eyes. We drive off at a leisurely pace, and they explain this guy is a frequent call and faking seizures and whatnot for substances S. We get there, and sure enough, this guy's flopping around, giving a truly Oscar-worthy performance. And the lead medic is talking to their partner, but like so the patient could hear, how it's not a real seizure, because he didn't crap his pants and he can administer the substances just as soon as he craps his pants, and they know it's an actual seizure. Sure enough, a moment later, dude loudly craps himself. And the medics are cracking up saying, "Dude, we made you crap your pants for nothing, you faker." I thought it was hilarious until they said I could do the assessment during transport on his crafty-ass solo. Because it's good experience, story 28. When I was an EMT in NYC years ago, we had a call for a man unresponsive. We entered an upscale apartment that was a hoard, floor-to-ceiling newspapers and magazines, just a mess. The woman who called said her brother was in his bedroom sick. We entered his room and it was pretty obvious that he had already passed away. She had placed a bowl under his mouth because he had hemorrhaged, which had coagulated the day before. It was crazy. We asked her why she hadn't called sooner, and she said thought he'd get better. The joke around the house was, if you have to put a bowl under a relative who is bleeding from the mouth, call 911. Don't wait. Never thought we'd have to advise anyone to do that, but there you go. Also, it was Thanksgiving. Didn't eat any cranberry sauce that year. Story 29, had a guy call because he had the cure to COVID and needed a ride to the local education hospital so he could share it. Dude was so high on met, he ended up having 4 or 5 binders worth of scientific looking notes. God only knows what was actually in them. Story 30, we got a call at around 4 a.m. and one of our notes for the call was, caller reports blood everywhere. So immediately, I knew this call was going to be interesting to say the least. So we started making our way there. On scene, we saw a few people outside, and as I get out of the rig, a man starts speed walking towards us frantically. Bro, you're not going to believe this crap, bro. My friend went into the restroom, and every once in a while, he'll make a weird noise, and when I would knock on the door to check on him, he would say that he's okay. After 40 minutes though, bro, I opened the door and he was lying on the floor covered in blood, and blood was everywhere, bro. My medic and I looked at each other and just told him to stay put out here while we take a look. Guys, I kid you duckin', not when I saw that I'd never seen so much blood cover a restroom this much before. We opened the door and we saw so much blood. I made my way over to him and asked him, "Sir, are you okay?" "Yeah, I'm fine." In the most casual voice, "Can you walk?" "Yeah," but he doesn't walk, so we had to grab his blood-covered arms and slide him on his ass to get him out of the impossibly narrow hallway to be able to get some vitals on him. Then that's when fire showed up, asking what, who, where, and how. I told the fire medic to take a look inside, and when his poked his head in and out, his eyes and fave looked him, he had just seen a ghost. My medic made a good idea to wrap the gurney in multiple sheets so the blood would soak into the mattress. Once the man was loaded onto the gurney, we started our way to the hospital. I could hear my medic talk to the patient. It went a little something like this. Medic: "So what happened?" Patient: "I don't know." Medic: "Where did all the blood come from?" Patient: I think it came from inside." Medic: "Your ass?" Patient: "Yeah, and I threw up some of it too." Medic: "Do you do substances or drink lots of alcohol?" Patient: "No." When we got to the hospital, that's when the shock started to hit him more. I will never forget my bloody man call. Story 31. Oh, I got this one. 1998. Paramedic called to a city bus driver with pain in right foot. Drive out to meet the bus full of passengers. Enter bus. Say we need to remove shoe. Said, "If it's broken or sprained, I can cut it off to not hurt you. If you truly think it's safe, I can untie and try to remove." He says he should be okay to remove. I untie my shoes, and the literal millisecond the lace is loose in 10%, he goes, "Ah, holy cow, the pain is leaving." His shoes were too tight. His shoes, too tight, but here's the kicker. He still wanted us to take him in. Story 32. I don't know if this qualifies as an emergency situation, but my dad, who was a firefighter and the county fire marshal at the time, set the fire station on fire. He was at the station, not on duty, but getting some stuff done in the office, and went out into the bay to smoke a cig. There was a can with sand in it for butts, and instead of putting the cig out in there, he just flicked it towards the can and went back inside. He sat down on the couch in the main room to watch TV, and a few minutes in the screen went black before a commercial, and he saw the reflection of flames in the TV, jumped up and saw through the window in the door that the wall was on fire. He ran and got the extinguisher, and the flames were moving up the wall fast. He put it out before it did significant damage, but it was definitely noticeable and a little humiliating for him to admit to. Now we joke about it a lot, but if he would have gone back in the office, there's no telling how bad it could have gotten before he noticed. Story 33. Got a call on New Year's Eve day a few years ago. We'll never forget it. Call from the dispatch was that they needed extrication in an apartment complex. We show up and enter the second floor apartment, and there are 3 guys in the room, clearly knackered and loving life. They've been drinking all night, and the evidence is everywhere, and they're hysterically laughing. They direct us to a 4th guy, who we didn't originally see, who is half in the apartment, half out. Let me repeat that. Half in, half out. His top half was sticking out from the floor, and his bottom half was hanging through the floor into the apartment below. Backstory. The apartment below was owned by a friend, supposedly, and they had locked themselves out. There was a pre-existing small hole between the 1st and 2nd floor apartments, and the 1st floor apartment owner asked the 2nd floor apartment owner to try to get into their apartment by squeezing through the hole. They apparently discussed it for a while throughout the night, and the more intoxicated they got, the more plausible it became. They eventually threw caution to the wind and tried it. The guy got his legs through the hole up to this belly and then got stuck. He attempted to get out and made it worse. Here's where it gets comical. In attempting to get out, his pants fell down. So there he is, half in his apartment, half in the 1st floor apartment, stuck. Return to the main storyline. We forcibly enter the 1st floor apartment, and there is half a body hanging out from the ceiling, balls on full display. What the duck? Happy New Year's. Most amusing part to us was that we made a pro behold the guy's junk while we cut him out and raised him out of the hole back into the 2nd floor apartment. His friends were almost crying in laughter when we raised him out and his nakedness was on full display. Story 34. Dispatched to cutting toenails bleeding guy had lost his toe as he had no feeling in his toes. Dispatched to male stuck in chair. Yup, he was dead. A sad one. A recovering addict had cleaned up and got a job. Was doing well in life and caring for her elderly neighbor, including helping him with medication. He had a Dorset box with paracetamol every 4 hours, but often didn't take it, so she put the leftover tablets in a jar in the kitchen. She had bad toothache and couldn't afford a dentist, so every time she checked on him, she'd have a handful of paracetamol. Paracetamol overdose is a slow and painful way to pass. Last I saw, she was on the transplant list, but unlikely to survive long enough. Story 35. Not a responder, but I went to the ER for a bloody nose. I was bleeding for about 4 hours and then 2 hours at the hospital. They called a code blue and a bunch of people came running in. My wife said the whole room was filled with doctors and nurses. I almost died because of a bloody nose. They cauterized my nose on both sides and I went home fine. I threw up a ton of blood before passing out. My wife said I turned green and the machine started going off. Story 36. My neighbor opening his gas line in his basement and then lighting a match to see inside. He blew up his house and took several hours to put out and caused damage to my house. But from that, insurance paid for a week trip at Disneyland. Story 37, 7 p.m. on a Saturday evening, summertime. Get called for a person stranded on an island in the river yelling for help. We respond with boats and retrieve a very, very drunk mid-20-year-old who was kayaking with her friends when they stopped at an island and took her kayak and left when she went to pee. She had no cell phone and no contact info for anyone who could pick her up. We couldn't just leave her at the boat launch, so handed her over to the sheriff's deputy. 1:30 a.m. that same night, we are dispatched for 2 individuals stuck on an island needing help. Again responded with boats, only to find 2 very drunk individuals with 3 kayaks standing on an island perfectly fine. Transported both in kayaks back to the boat launch. Neither had a vehicle or a ride to get to said vehicle. Again, handed over to PD. I really hate drunk kayakers. Story 38. I was doing at work at a small town police department when a 911 call comes in from a woman saying that she arrived home and can hear someone in her house moving around even though all family members were out. PD notifies surrounding towns to help establish a perimeter in case the burglars try to flee. Cops go lights and sirens to the home, get inside and start a room-by-room search. Well, it ended up being a Roomba search because the noise the woman heard was a Roomba robot vacuum that got itself trapped in a hallway closet. It kept banging into the walls trying to find its way back to the charging base. Story 39. Am not a first responder, but more so a last responder. Went to pick up a young man from the morgue, where for an extremely rare occurrence, small town, coroner knows everyone, the immediate family was sitting in folding chairs in the actual room where autopsies are performed. So I walk into the morgue, the body is on the metal table, the mother, father, and couple siblings are about 4 feet from him watching me. I was talking with the family, offering my condolences, and the dad said, "Well, my son died doing what he loved." I asked what that was, and he said, "Driving that little rocket he's got." The guy was driving his rocket down the sidewalk at top speed and was so tall that his head collided with the edge of a stop sign, the octagon part, and it just hit his head. It made sense when I thought about it, but it was an insane-ass story and felt so avoidable. Story 40. Not me, but a high school teacher who was a volunteer EMT. A woman was taking a block of hamburger patties out of the freezer to feed a bunch of people. They were frozen together, so she braced them against herself to pull them apart. Except she used a sharp knife to try and pry them apart. The knife slipped on the icy patties, and because she had the knife pointed inward, while she braced the stack of patties on her belly, the knife hit deep into her thigh, right next to her groin. The woman was out in the country, so the ambulance did not make it before she bled out. I remember the lesson to this day. Never cut towards yourself. Story 41. This guy had 2 lithium batteries for his vape in his pocket, where several coins of change were also in the same pocket. Between the static building up and the perfect alignment of the batteries and change, completed a circuit, and the batteries ignited on fire and burned him. Luckily, her reached into his pocket and threw the batteries out, suffering at least the 2nd-degree burns on the tips of his fingers. We thought it was bullcrap until we stepped into the room and smelled burning clothes and flesh, taken to the burn ward. I guess the PSA for today is don't carry loose batteries in your pocket, especially with spare change. Story 42. The amount of men that need emergency care and have things removed from their rectums that got there because they fell on them, naked, accidentally. Story 43. Called to a cardiac arrest requiring CPR. Got there and wife said that husband was a type 2 diabetic. Not only that, but for the last few days his blood sugar had been high. I asked how high and she told me that his blood sugar had been so high it maxed out his reader. For over 24 hours had been over 400, which was as high as it read, and no one called an ambulance. If he'd just called an ambulance, he would still be around. Story 44. Not a responder, but I got to witness it. Long story short, a woman tried dialing out from the hotel I work at, which requires you to dial 9 in place of the 1 at the start of the number, but kept dialing it as 91 and then another 1 as part of the number she was calling, which triggers the phone to start calling the police. Doing that will trigger the front desk phone to tell which room is trying to call out so you can be aware and also calls the police. She does this twice, and instead of explaining the mistake, either time just instantly hangs up when they reply it's the police she has called. The police are obligated to investigate this and come check the room as a routine welfare checkup. The woman passes them on the way to the elevator and leaves her boyfriend in the room to take a shower. The boyfriend doesn't hear the police knock, so they open the door with a master key to speak louder into the room, and in the process see at least 4 different types of illegal on the dresser. The woman never tried to stop them and explain the situation because she was too embarrassed to do so. The boyfriend goes to jail because he was in the room when it was found, and the woman has to leave the hotel ASAP, but otherwise is let off scot-free. So basically, she accidentally almost turned them both in and got him arrested for her idiocy. Story 45. Paramedic here. Not my patient, but I was bringing a patient to the burn unit of my local hospital and met a fellow that was just getting discharged after a few weeks stay and plenty surgeries. Apparently, his stove caught on fire and he decided to out the flame by spitting vodka out his mouth onto the fire. As you can expect, he suffered some severe facial burns. Story 46. Got a call once for a kid throwing rocks at neighbor's car. No big deal. I'll swing by on my way to lunch and give him a good talking too. Turns out the caller was the kid's aunt. The kid was a 30-year-old man with PTSD. The rocks he was throwing was the size of basketballs. When I got there, he had gone into his room in his mom's house. When I told his mom I would need him to come out and talk to me, she said, "Okay, but just so you know, he likes to carry knives." 2 hours later, he came out, gave up the 2 knives he had hidden in his socks, and went along peacefully with paramedics. Story 47. Attended a MVA motor vehicle accident involving 2 people in their late 70s, and we found out that the driver was blind and his wife would direct him around because she never held a license. They survived with minor injuries, but for me, bizarre or stupid decisions like that really boil my blood as a first responder. Story 48. Elaborate for me, because just about 70% of all emergency calls are from something stupid. The other 30% are people with genuine health issues. BTW, these are just estimation statistics of my department after working there 5 years. By no means are they accurate statistics everywhere. Story 49. Man lost his fingers with fireworks because he was using them to hunt the ninjas attacking his property. Story 50. In 2008, there was a massive fire that threatened homes in multiple cities, and I was called out while in the middle of assisting with evacuating senior residents, etc., on a few ridiculous could-have-been avoided calls. One was a guy who fell off his roof while trying to get a better view of the fire, and another was a car who decided to drive past the freeway, redirect, and straight into the freaking fire. My favorite, which is unrelated to your question, but I'm remembering it now, so wanted to add it. Someone called 911 because the fire was getting more attention at home than they were. Story 51. Had a patient who was reading a book with the sun shining in their eye for 30 minutes. They called 911 when they got up and were blind in one eye. After sitting with them for a few minutes, their vision began returning, so we left story 52. eating sunflower seeds without spitting out the shells. The boy ate an entire package. Cube XR showed lots of pointy teardrops in the rectum. You know that hurt on the way out. Story 53. ED nurse here. Once had a lady came in screaming down the house with a huge rag around her finger. Thinking she may have lost her finger, we took her in. Upon looking under the rag was a small splinter, and with one flick, it was out. Believe it or not, that wasn't the stupid part. We then offered to give her a tetanus shot, but refused as it was going to cause pain and said, "That's over, kill for a small splinter." I damn near face-palmed in front of her, but I held it back and sent her on her way. Okay, here's the best bit. 4 days later on my shift again, the lady came in but was super quiet and just needed to be seen urgently as her hand is infected. I knew exactly what it was and pushed her through. 2 tetanus shots later, plus a lot of antibiotics. Later, she was sent in for an arm amputation. Story 54. Tow truck driver here. Not your typical emergency responder, but I guess I technically am one. Last week, I was responding to a double-header, 2 cars involved accident. And on my way there, a drunk driver hit the crash that had already happened and turned it into a triple header. Unfortunately, I have no knowledge of the people involved, and if they were okay or not, hopefully they are. Interesting night though, story 55. A guy was doing some backyard mechanic work and pulled his truck right behind the older Mustang he was working on. Used a jimmy-rigged 4-jack system and went between the truck and the Mustang. 2 jacks slipped and pinned his head between the Mustang's rear bumper and door of the truck. Fire and EMS attended as well, and once the guy was freed, he refused medical attention. Alcohol was definitely a factor. Might have been the luckiest unlucky guy I've met. The 2 remaining jack just kept enough of the vehicle weight. It didn't hit his head. The truck had a 5-inch dent in the door from his head. Had it been on a pillar, he would have had a bad time. Story 56. Not an emergency responder, but I have a story. We were at the park for school sport, and there were a couple rope swings hanging from a tree. They had little noise at the very bottom to put your foot through to swing. One of these came undone, so my friend tied it back up, but it was much bigger, and one of my friends joked about it, looking like a noose you hang yourself with. My friend went along with the joke and put it around his neck, but then something happened, and he lost his footing and slipped over and actually got hung. He was there for a bit before one of my other friends next to him was pushing him up to let him breathe. The teachers got him down and he was okay, but he still had to have an ambulance called and get taken to the hospital. He's absolutely fine now and no lasting damage, fortunately. We think this could be because my friend realized he wasn't joking around like a couple others thought and actually tried his best to support him. I think he put his back out doing it. Story 57. Working in the eddy. Years ago, we had 2 patients come in one after another Biba. One was a man screaming in agony as blood covered his balls. The second was a young woman who had just had a seizure. Someone got their junk chewed. Story 58. I was interning with a police dept. They got a call about a drive-by shooting in the early hours of the morning. One guy was hit in the arm while trying to run. EMS gets there and the victim's buddy is holding him down, pouring bleach into the open wound. EMT and PD yell at him to stop. The buddy just says he was trying to disinfect the wound. Story 59. Not an emergency responder, but I had phimosis. And the first time I used a fleshlight, my foreskin pulled back, but then got stuck like that. And the combination of the sensitivity and raw panic caused me to puke and crap myself and pass out on the bathroom floor. I nearly called an ambulance at one point because I thought I was having a stroke. After a few hours of this, I called a friend who's handled significantly more junks than I have, and we did some troubleshooting. Turns out, foreskins can fold over on themselves, so I just had to get hard again, and it popped back out. Story 60. Don't put things without handles inside. Don't dry your towels on lamps. If you can, don't charge your e-bike scooter indoors, or at least don't overcharge them or overload your outlets. Don't drive on bridges like you're trying out to be a Fast and Furious stunt double. Pay attention to all signs whenever you're driving so you don't try to drive the wrong direction on a highway. Try your best to avoid that zesty new recipe from Chef DiGiorno while you're absolutely crap-faced and exhausted at 4 a.m. Story 61. Have a bit of a sad one. Guy hit his head really hard. Parents were concerned and wanted to take him to the hospital to get it checked out, but he convinced them not to, saying he was fine and everything. Ultimately, they decided that since he was talking and acting okay, he must be okay. A few hours later, he started complaining of a really bad headache and then collapsed. His parents rushed him to the ER, where he was diagnosed with a brain bleed, and by that time, it was too late. He was taken off life support about an hour later and died. The doctors told his parents that if they had taken him to the hospital when they wanted to, he would have lived. Story 62. Not me, but a good friend. Paramedic in a major California city. In this city, there's very narrow gaps between buildings. Dude fell into the gap. Only way to get dude from the gap was to punch a hole through the wall of this elderly woman's apartment. They urges the old Russian woman not to come into the room they were breaching through to retrieve the dude, because the scene might be ugly. Woman goes into the room anyways, sees the firefighters pulling the body of dude in the wall. She has a heart attack and is dead on the scene. Story 63. Got called out on a fire at the home of someone who thought it would be a good idea to cut down a whole tree, shove one end of it in the fireplace, then just push the rest in periodically as the end in the fireplace burned. Turned out it wasn't a good idea. Story 64. I had a guy that wanted to end his life, so he jumped off a bridge onto train tracks. But in the very early hours of the morning and on a holiday weekend, he managed to get someone's attention and called for help. We had to haul him off the tracks with a broken leg, and I think he broke his hip too. He wouldn't stop complaining about the whole thing. Story 65. A friend from countryside had his college buddies visit his hometown as it was little on the hilly side, with streams and a forest and small canal, a natural beauty. Decided to visit the canal on evening and lit up a little bonfire as the sun set and it got a bit darker. And just for added fun, they picked the sticks from the bonfire and held them while riding back home on their bikes. Bits from those sticks fell on the path and had resulted in a major fire. The fire department controlled it quickly, but still a lot of damage was done. The bonfire location was discovered by the fire department, and the path that my friend and his buddies had taken was concluded to be the origin of the fire. My friend and his buddies remained silent about it till my friend narrated the incident to few close friends. Story 66. I worked as an EMT for about half a year. The pay was horrendous where I lived. And one time there was a young male who called 911 but couldn't leave his bed to open his apartment door. The reason why was he had accidentally stuck a glass jar up inside and couldn't get it out. The problem was his glass jar was of poor quality, and it already started cracking, causing him a lot of pain and bleeding. It was a long night. Story 67. It's not my side of things. I just fix the things that guys break, but you know those baby swings in play parks with the square hoop bit above the seat and the two uprights, so toddler-sized children don't fall out? Very frequently, there's a call to cut someone out of those. Nearly every time, it's a skinny girl. Girls are supposed to be more sensible than boys. Story 68. This is probably the most boring reason on this thread, but it is responsible for the most emergencies, not going to the doctor and letting a minor issue become a medical emergency. Preventive care and regular doctor appointments save lives. Story 69. Gun cleaning, clear the chamber. Even after you've done it, ducking, check it again. You would be surprised how many people unload a round into their legs. Story 70. Out on a movement for the military. When a guy out there decided, since he didn't have cleaning solution for his contacts, that he would just clean them out in his mouth. So he brushed his teeth and then proceeded to put his contact in his mouth and swish it around. About 2 days later, he comes saying he can't see and asks to be seen by the doctor. He then launches into why he did what he did and what his brilliant solution was. Needless to say, the mouth is one of the dirtiest orifices on the human body, and he got mouth germs in his eye, which gave him a huge eye infection. They ended up being able to save his eyes, but it was barely, and he definitely got them messed up for a long while. Story 71. I responded to a death attempt where it turned out the guy intentionally lost his hand. I put a tourniquet on the arm and kept the guy talking until rescue arrived. When we put him on the cot, he got combative, and it was pretty crazy for a few minutes. Got him in the squad, another officer rode inside, and I followed. A couple minutes later, rescue contacted dispatch and asked if someone could go back to the scene and retrieve hand, which had been forgotten in the excitement. I turned around and drove back to the house, turned into the driveway, and at that moment a pit bull went tearing past me with it in his mouth. I chased him, but he disappeared. We never found the hand. Story 72. I had an elderly lady who had rolled out of bed after having a nightmare. The front of her hair got caught in the top drawer of her bedside cabinet, resulting in her descalping herself. The doctor stapled it closed in Ed, and then we sent her home. She only required paracetamol, even though we offered her substances. Story 73. Co-alarm call. Goes off at 2 a.m. in the morning. No sickness. Elderly person is still inside the house when we arrive. Alarm had been going off for the past 24 hours. Turns out the alarm was faulty and needed to be replaced as they regularly do. Homeowner thought he was safe from carbon monoxide because he was on oxygen and therefore invincible. Not exactly an emergency situation, but pretty dumb. That was almost an emergency situation? Story 74. A couple was having sex and the male hit his foreskin. They had to call 911 because he was bleeding so badly and their baby was sleeping, so the mother couldn't leave the home. I don't even have a junk, and I felt the pain of that one. Also went to a gentleman that was having sex with 2 other men he met the night before. They were all high on meth, and the patient had a massive heart attack. Police had to use fingerprints while he was unconscious in the hospital to ID him because his partners didn't know who he was or where his id was. Story 75. I was an EMT for 7 years. We went to a call in 2010-ish where a dude was high as a mofo. He lost his own balls and thrown them in a bush. The only reason he didn't bleed out was he was with sober people, and they called 911. Story 76, gas troubleman here. I once responded to a gas leak at a home after the family returned home one evening from work and smelled gas as they pulled into the garage. They went to a neighbor's house to call it in. Turns out their house was full of gas, past the explosive levels, due to their toddler turning on one of their gas stoves as they were leaving for work that morning. We had to kill the power and internet service to the house before we could go inside and vent the gas. So thankfully, no boom boom. Story 77, EMT here. One day we received a call for a full arrest, so we take off. We pull into an apartment complex with the patient standing outside waiting for us. Okay, strange, not a full arrest. We pull up, fire department and us, and start talking to the patient, 20-yo male. Apparently he called because he felt like he was having a heart attack. Okay, no problem. What were you doing before this happened? A hole said he downed 4 monsters and doesn't feel right. The next 30 minutes consisted of me lecturing him on not doing that and that he was wasting resources being an idiot. Too many stories, so many idiots. Story 78. I was a volunteer at the Tel Aviv ambulance service. Fight, literally. 2 young men, possibly from the same family, had an argument and decided to settle it with a fight. They had very deep cuts all over their body. One of them kept saying, "Something's wrong with my head," over and over all the way to the hospital. I never thought I'd spend so much time cleaning blood from a van's floor. Story 79. Man working in a factory type setting decided to use one of the machines to pleasure himself. Got stuck, completely degloved his balls and most, if not all, of his junk. "Sir, you need a mechanic and a surgeon, then a psychiatrist. I can't help you." Mechanics did have to come and take the machine apart just to free him. He then went to an ER in handcuffs, then straight to jail out of the OR. Turns out, he was an offender. Nurses have read it. What is your funniest emergency room story? I used to work in the ER sometimes, and when we would pull stuff out, it would get washed and sterilized and put in this box under the triage desk. When a new person started, we would run a pool on who could get the newbie to use something out of the box first. I won it once by taking the staples out of his stapler and then casually mentioning that, "Hey, there's a stapler in the box under the triage desk." I won $150 that day. Story 2, not my story, but heard it from my cousin. She was training for her nurse diploma at the time at a local hospital. So there's this old guy, 70 to 80, coming in the ER with a big wound on his leg and he had to go for surgery. My cousin tried to prepare him for the surgery and asked him to remove his boots and clothes so he can change into proper clothing. The old guy started yelling and cursing because he didn't want to get his boots off. Several doctors came by to calm him and he started to fight them too. After some time when he calmed down, they injected him some anesthetic in order to remove his boots without him flipping over. It turns out he was ashamed to take them off because he had his nails painted red. Story 3. Or that time a nice fella taking a colonoscopy prep overdid it and got to vomiting just when the diarrhea kicked in. Eventually, exhausted and empty, but feeling better, he thought he'd try to get approved to go ahead with the colonoscopy instead of wasting the prep. G said okay if he went to the ED and got checked out for dehydration infection. He hopped into the shower, cleaned off in a hurry, and came to see me, having failed to notice that he used his teenage daughter's fancy, silly glitter body wash. This big, macho, muscular, conservative-looking 50-year-old man, glittering like Edward from Twilight. Once he heard the workup was okay and he was clear for the scope, we all had a great laugh. Story 4. I once took care of someone who registered with a complaint of suspected latex allergic reaction. This happens periodically, and for whatever reason seems to more often present with lips and tongue symptoms after a condom was used during sex. However, it must have not been bad because the nurses didn't signal to me that this patient needed to be seen ahead of the others waiting. If you are waiting in the ED, that's a good thing. It means the nurses think you are less sick. Eventually, I work my way through to her and enter the room to see a woman sleeping peacefully covered with a man's jacket, while the man stands against the far wall. She wakes easily. Examining her, she's clearly not having hives or anaphylaxis or contact allergy, but she does have an odd, fine, flat red rash around her eyes and upper cheeks. They are very hesitant about explaining what was going on. They nearly always are. But it eventually comes out that they had sex with a protection, then removed, and she gave him sex. Then she went to the bathroom and saw the rash. This wasn't making sense. It wasn't an infection or abrasion or an allergy. In fact, the rash looked petechial, which means tiny burst blood vessels under the skin. Oh wait, this is where I pull out my best trick and squint at them, consider what I think they were doing, dial the kink up 3 notches, and matter-of-factly ask if they were doing that, with excellent eye contact. This resets the hurdle for embarrassment and gets people to open up. So, no, they hadn't been doing breath play or choking, but yes, there was some forceful gagging during the sex. The part that made it funny was that this was clearly either a paid encounter or a Tinder hookup, because the dynamic between them was so fastidiously polite. Story 5. I work inpatient, but here are some stories. The patient had a UTI. She told me that a previous nurse had told her to wipe front to back and how ridiculous that was, as she had wiped back to front her whole life and was fine. I asked her if she had ever had a UTI before. She said, "Oh yeah, all the time." Had a patient who was coming down off of Met. He insisted that he had been kidnapped because a hold had been placed for very valid concerns about violent behavior. He called 911 and said he had been kidnapped. The police arrived to make sure everything was all right, make sure that someone hadn't actually been kidnapped. When the patient saw the police, his response was not, "I have been kidnapped, please help," but to try and attack the police. We managed to disengage him without anyone getting hurt. As soon as they left, he demanded to use the phone to report his kidnapping. Story 6. My ex was a nurse, and she once attended an emergency surgery of a guy who had been hit with a spork. For some reason, on the fork side of the spork, there was a little piece of wienerwurst attached. The surgeon's hand trembled from laughter during the whole operation. When asked during recovery about what happened, the guy said he'd slipped while eating dinner and fell on the spork, but the authorities suspect there was something more sinister going on. Story 7. Nurse here. We had a young patient come in. Female, 20 hours. She was very weird, shaking and couldn't stand. She looked anorexic. Now, since she was puking, we had to give her an IV drip. So we placed that in, and I watch over her in the ear room. And there's a door next to the bed she was on that leads to the outside for easier access of the air room if there is an emergency. So I look at her and ask if she's okay, and she is sitting up and goes, "Yeah, I'm fine." Mind you, she couldn't move for the past 30 minutes, and we literally had to carry and lift her up. Now she is sitting there and has this dead stare in her eyes. My coworker steps closer to the room, and as he is about to ask if everything is fine, this girl rips the IV drip out of her, jumps over everything in her way, opens the door and runs outside. Now this is a smaller town with a small air unit. And there I am, 5'1" tall woman chasing that skinny girl over the whole town. She was in nothing but a bra and pants because of ECG in the middle of winter. Behind me was my coworker, 2 paramedics, 1 paramedic car, 3 cops, our doctor with dispatch on the phone. And we were chasing her for a good hour. Everything turned out fine, and she was admitted to the hospital the second we caught her. Nothing bad happened, thank God. But it sure was funny, since we were filmed and put on national TV under breaking news. We still get a good laugh out of it every once in a while. Story 8. My mom has been a nurse for my entire life, and I remember when she did her stint in the OR at our local hospital. She told me some guy came in complaining of pain in his ass, but would not specify to the female nurses what happened. Being that the OR was a zoo, they implored the man to be honest just because they didn't have many men working on the floor. And since he was not in crisis, he may have to sit for a while. Finally, the man broke down and told them he was home watching some adult films, this was the early 90s, when he got curious about a certain thing he saw a male performer do, but unlike the professionals, this guy couldn't get it out, and it was currently stuck in limbo. She said he got lucky they were able to get out completely. Story 9. I had a manic guy on a psych hold who eloped, ran like a gazelle out to triage barefoot, in only his underwear once there. He stopped and weighed himself. Then, faced with his choice of 2 convenient doors out to the lobby, he instead climbed up onto the counter and through the little triage window, ran outside, still barefoot, and stole a police car. Story 10. Not sure if it counts because it's not in the ER, but it still makes me laugh. Student nurse here. I work in home care. I once got a call from a client who was freaking out because a friend brought her home, and now her friend said she didn't feel well, to the point she wasn't responding anymore. So here I go, rushing over, thinking about the questions I need to ask, things I need to observe, possible outcomes, etc. I arrive at the client's house. My client comes running to me. Come fast, come fast. There she is. She runs to the couch and starts rubbing a pillow. Turns out she was hallucinating. Story 11. Or, that time someone had an allergic reaction and for some reason brought in live mussel for us, which HR thought he had reacted to, in a little jar full of water, like a goldfish or something. We kept our little mussel friend for most of a day in the charting space. He did not contribute meaningfully to the workup or treatment plan. Story 12. There is an unfortunate psychological illness known as Morgellons syndrome, or delusional parasitosis. These people firmly believe that little worms are emerging from their skin. They often present having picked at, scrubbed, scourged, and otherwise damaged their skin, with little samples of skin flakes and hair and cotton threads from their clothing which they insist are worm. Punchline, they aren't worm. So one day, the charge nurse asked me if it was okay to put 2 patients, roommates, both concerned about fleas or scabies or some sort of environmental itchy rash. Sure, I said. Never again. After meeting them, it was rapidly clear that there wasn't a medical cause for their itchiness and skin picking. The rash pattern, the pictures on their cell phone, just not consistent with reality. But I'm a softie and determined to be exhaustive, so I asked them where it started. They told me the worms came out of their ears and eyes. I dutifully looked into their normal eyes and ears. Then they said the worms started inside. Okay, so I set up to do a pelvic. This is when it all went very, very wrong. Suddenly it became clear they were lovers, and the partner was trying to reach in to show me where the non-existent lesions were. I noped right out of there. I do not do participatory pelvics with delusional people. The diagnosis is folie à deux with delusional parasitosis, and the lesson is no group pelvic exams with psychotic people. Story 13. I was in charge one day and was called to rescue my reach, who had been pulled to sit with a psych PT. I go down and he's pale and shaking, and his patient is straining at his leathers and screaming. I told the patient to calm down a sec so I can talk to my tech just to be a smartass, and he actually did. I told my tech to chill and call me if he needs me. I then told the patient I was done talking and he could go back to making a ruckus if he wanted. The meds had kicked in though, and he just called me Fat Mary Poppins as I left. Story 14. Not me, but my friend is a paramedic. They had a regular who'd always have heart attacks, and this time was no different, except it was much more serious. He was clinically dead for a few minutes, so she made the decision to wind down the CPR as he'd have severe brain damage at the very least. They were just about to stop when he suddenly took in a deep gasp and opened his eyes. He sat up straight and just started chatting to them. His first words, in fact, were, "This isn't Sainsbury's." They kept trying to get him to lie down and remain calm, but he kept joking around instead and said he was used to it. They took him to the hospital, but he refused to be stretchered in or to even use a wheelchair and just wanted a coffee. My friend was completely gobsmacked as him being brought back without any brain damage whatsoever or even being as aware and calm as he was, a complete miracle. Story 15. Not a nurse, but an MA, and I once had a patient that was a Catholic priest that developed a skin rash. He was treating it with that spray Clorox cleanup solution, which of course only made it worse. When asked about the rash, he said he caught it from his wife and then pleaded with us not to report him to the head guy at his church since he's not supposed to be married. Obviously, we can't report things like that due to privacy laws. Turns out his wife was an escort that was also one of our patients, unbeknownst to either of them. Story 16. Not a nurse, but I bet she told everyone because she was cracking up at my innocence. I had the need for a poison ivy shot, and my dad told me they hit your butt. So nurse says, "Time for your shot. Can you me? Pants down, butt out, pull your waistband down." The funny part is, I kicked my shoes off as well, like I was about to get all naked and comfortable for a 1-second shot. We all laughed real hard at that. She had the pants down before, but never the shoes kicked off. Story 17. Not the nurse, but the subject of the story. I shattered my ankle and was waiting in emergency for next steps. The nurse comes in all business, tells me, "I need to take off your pants." My immediate response was, "Shouldn't we at least have dinner first?" She paused, turned bright red, then spun on her heel and left the room. About 30 seconds later, I hear the nurse's station erupt. I do sometimes wonder if she still tells the story.